Hi, I'm Dr. Flora Waples, founder and medical director of Restore Medical Spa. And today we're going to be talking about the top 5 questions I get about the LaseMD. First question I get is, well, what the heck is that? Medically speaking, it's a 1927 nanometer thulium laser. It's just a fancy way of saying it's a resurfacing laser. Like our erbium laser, our LaseMD acts similar to resurfacing a wood floor. We use the laser to polish the skin, remove fine lines, improve tone, quality, texture, and reduce pore size. Nice thing about both the LaseMD and the erbium lasers is they'll also remove a little bit of sun damage while they're at it. So really, it's like polishing a wood floor. Looks beautiful when it's done. The second question that people ask about lasers like LaseMD or the erbium is they say, well, doctor, is it going to hurt? The answer is, it depends on how much energy we're using. We can use these lasers to do just a light little buff coat, or we can get down there and really refinish that skin. How much energy we use determines how deep we get and also how uncomfortable it is. Light treatments, most people can do that without any numbing, with no problems. When we do our medium or our deep treatments, we'll put topical numbing on the skin, and if that's not enough to make someone comfortable, we do have nitric oxide or laughing gas that we can also use to help people tolerate the treatment. So the answer is, if you're doing a light treatment, probably nothing. If you're doing a deep treatment, we'll get you some numbing, get you on that laughing gas, we'll make that treatment comfortable for you. The third question that people ask me is, well, how does this work? How do lasers work? The medical answer to that is it's selective photothermolysis, which is just a fancy way of saying I can choose my laser, the wavelength, the joules, the energy, to specifically pinpoint your problem areas, whether that's going after fine lines, going after brown pigments, going after red pigments, or just polishing the skin in general. It works because we can set our lasers to put heat into whatever structure we choose, whatever structure is the one that's bothering you the most. Question number 4 that people ask me about lasers like LaseMD and erbium is, how many do I need? As a general rule, per year, you're going to need 1 for each decade of life. And why is that? The answer is because your body becomes less able to respond to that regenerative stimulus over time. The analogy I use is going to the gym. When you're in your 20s, you go to the gym once a week, you're going to be in phenomenal shape, right? Your body is ready to go whenever you tell it to regenerate. A 20-year-old body is right there. When you're in your 40s, if you want to stay in good shape, you're going to need to go to the gym really 3 or 4 times a week, right? And if you're in your 60s and you're trying to run a marathon, you better be working out every day. Our body becomes less able to regenerate over time. And to combat that, we need to give those signals more frequently. So when you're thinking about skin regeneration and using a laser to regenerate your skin, think 1 per decade of life. It's a good rule of thumb. The last question that people ask me about resurfacing lasers like LaseMD or the erbium is, well, when should I start? We reach peak collagen production at about 25. That's when our skin has the most collagen content in it. Every year after that, we're losing a few percentage points. So if your goal is prevention, you should start at 25, do 1 or 2 treatments a year, and you can just keep that collagen level steady and never have to see that drop off. You'll never develop those fine lines. You never develop those problems with tone, quality, texture. We can just keep your skin pristine. If prevention is not what you want to do, then probably these lasers are going to come into play in your mid-30s, which is when you're going to start seeing the collagen deficits that have been rising gradually for the last 10 years. So in my mind, the answer is now. And those are the top 5 questions that people ask me about laser resurfacing with LaseMD and erbium.